Rural residents often encounter barriers to healthcare that limit their ability to obtain care they need. Access to healthcare implies that healthcare services are available and obtainable in a timely manner. Yet, rural residents often encounter barriers to healthcare access. Even when an adequate supply of services exists in the community, there are other factors that may impede healthcare access. These rural health disparities are deeply rooted in economic, social, racial, ethnic, geographic, and health workforce factors. That complex mix limits access to care, makes finding solutions more difficult, and intensifies problems for rural communities everywhere. The statement of problem within the article is challenges healthcare poses to patients, families, and communities living in rural America. Maintaining the healthcare workforce is fundamental to providing access to quality healthcare in rural areas. Rural healthcare facilities must employ enough healthcare professionals to meet the needs of the community. However, healthcare workforce shortages are significantly impacting healthcare access in rural communities, specifically the inadequate amount of physicians and specialists readily available. It is believed rural communities are short approximately 20,000 primary care physicians. And then comes the dilemma of physicians less likely to stay in rural areas to practice medicine due to ill preparation. A shortage of healthcare professionals in rural areas of the United States can restrict access to healthcare by limiting the supply of available services. The most significant outcome of the study is that social determinants of health significantly impact rural health. Social determinants of health are factors that influence health outcomes, meaning the societal circumstances in which individuals are born into, live, and grow, and systems that shape the conditions of daily life. Factors such as economic stability, education, environment, healthcare access, and quality undoubtedly affect the quality of life. In addition to fragmented communication that impairs rural health systems' ability to function. These issues exacerbate the difficulty of ensuring acceptable and appropriate delivery of healthcare services, which compound all other barriers to healthcare access for rural residents. Healthy aging in rural areas present unique challenges. Access to high quality health and healthcare services are key components of healthy aging. However, with fewer healthcare providers, fewer professional caregivers, and fewer young people than in urban areas, rural communities struggle to care for aging residents. In addition, social determinants of health also affect population health, thus causing patients to delay healthcare and healthcare services in rural communities. For example, transportation. Transportation issues include but are not limited to the lack of vehicle access, long distance, lengthy travel times to reach healthcare facilities, transportation costs, and inadequate infrastructure. Inconvenient or unreliable transportation can interfere with consistent access to healthcare. Traveling to receive healthcare services places the burden on patients. For individuals with low incomes, no paid time off from their jobs, physical limitations, and acute conditions, these burdens can significantly affect their ability to access healthcare services. To address the challenges of healthcare in rural communities, the article recommends that medical students need to be encouraged to practice in rural areas. And one way of doing this is exposing medical students to rural clinical settings. Health professionals in rural areas must care for a broad range of health issues and problems, be adaptable to local conditions, work collaboratively with other providers, and augmentate their skills depending on the community needs. They need to learn and acknowledge taking care of patients in the context of where they're coming from and where they live. They need a curriculum that builds student culture sensitivity to rural patients. Secondly, telehealth and other technologies can make it easier for patients to access care services and health records. Improving this type of access can help improve the quality of care for hard-to-reach patients. Advancement in technology and digital platforms have made it easier to access all kinds of resources with a touch of a screen, including the opportunity to meet with a physician or other healthcare professionals without having to set foot in a healthcare facility. Assessing the article's effectiveness from the perspective of a health administrator, the article provides excellent insight on the difficulties of obtaining and retaining healthcare providers in rural areas. Secondly, by investing in rural healthcare facilities and their training opportunities, it would help to meet the organization's missions and values, thus improving the quality for functionality. Lastly, it emphasizes the need to invest in technological advancements not only for the betterment of healthcare providers but also for patients. Through the utilization of technological advancements such as telehealth, it would provide patients and healthcare providers the same face-to-face engagement that would have been done in person. Furthermore, telehealth would cut transportation costs and time they would have missed from being at work.